A very good afternoon to one and all. I'm Dr. Shanmugapriya. Today's topic for discussion is inhalational anesthetic agents. So before going to the topic per se, do you all know what is an inhalational anesthetics? Any one of you? Okay, I will tell you. This inhalational anesthetics will comes under general anesthesia. We use the inhalational anesthetic along with the IV drugs so as to give the balanced anesthesia. So the main objective in my study is physical and chemical properties of the inhalational anesthetics, which pharmacodynamics, and their adverse effects. So moving on to the classification, it has been broadly classified into gases and vaporizer. So under gas, we are having two gas, nitrous oxide and xenon. Whereas in vapor, we are having two different components. One is hydrocarbon compound and halogenated hydrocarbon compound. Under hydrocarbon compounds, we are having this following inhalational agents: diethyl ether, divinyl ether, ethylene ether, and cyclopropane. Whereas in halogenated hydrocarbon compound, we are having the following agents: ethyl chloride, chloroform, trichloroethylene, methoxyfluorine, halonine, N-fluorine, isofluorine, sevofluorine, and desfluorine. So we will see the each and every component individually. First, we are going to see the ether. As you all know, what is ether? Any one of you? Yeah, ether is an inhalational anesthetic agent. So it has been found out by W.T.G. Martin in the year 1846. Yes. Okay. So ether, since it is an oldest anesthetic agent, still it has been taught even now also. Yeah, this is found out by W.T.G. Martin in the year 1846. And what is MAC? It is a minimal alveolar concentration. With that alveolar concentration, we will reach the desired effect of anesthesia. Okay. So the MAC for ether is 1.92. And not only the alveolar dilution, it also needs the blood gas partial coefficient. Its blood gas partial coefficient is 12. So moving on to the properties of the ether, it is pungent smell and it's an inflammable and explosive. It is an irritant gas. So because of this, their use of ether is nowadays has been limited. Even though it is a slow induction agent and its recovery is also slow. Based on this ether, in ancient anesthetics, we have classified the anesthesia based on the ether anesthesia. It is by Arthur Goodall. We have 4 stages. So with these 4 stages, we will be starting the anesthesia, and 4th stage is the end. End is nothing but surgical plane, and even if larger amount of anesthetic agents enter, it will lead to the termination of the life. So based on this ether, Goodall staging was classified. Then this ether is a good analgesic agent, and it is also having the muscle relaxant property. So moving on to the nitrous oxide. Nowadays we are commonly using this nitrous oxide, which is found by Joseph Priestley in the year 1772. It is an odorless gas and it is non-inflammable, whereas ether is an inflammable agent. And it is having a low molecular weight and it is having very poor blood solubility of 0.46. Here the minimal alveolar concentration is 104%. This nitrous oxide, which has been used in the cylinder, which with the pin index of 3,5 and having the color code of blue. And usually this nitrous oxide is gas at room temperature whereas it has been liquid when it is stored under pressure. So because of this, once the cylinder got empty, even if you are opening also, this cylinder will show full percentage. So it has been stored in under vapor pressure as liquid. Once it has been released in the gas, it has been used as gas. Then moving on to the properties. So its effect on the CVS is arterial blood pressure, cardiac output, and heart rate remains unchanged. Whereas in the central nervous system, thus increase the cerebral blood flow and cerebral blood volume, and it has mild effect on increasing the intracranial pressure. It also increases the cerebral metabolic rate of oxygen. So in overall CNS, it has an increased blood flow action. Whereas in CVS, there is no change. In GIT, it causes nausea vomiting because of the activation of CTZ in medulla. Then in the respiratory system, it causes decrease in tidal volume and increase in respiratory rate. What is minute ventilation? So minute ventilation is nothing but respiratory rate into tidal volume. Okay, so because of this, there is slight increase in minute ventilation. Then moving on to the renal effect. It increases the renal vascular resistance, thereby causing decrease in renal blood flow. And also it causes, because of this decreased renal blood flow, the GFR also reduced. Because of this decreased longer filtration rate, urine also reduced. So in overall nutshell, CVS, what will happen? It remains unchanged. Whereas CNS, it increases the cerebral blood flow. Whereas in GIT, it causes nausea vomiting. In respiratory system, increases the tidal volume, decreases the tidal volume, increases the respiratory rate. Whereas in renal, it increases the renal vascular resistance, thereby decreasing the urine output and GFR. Then moving on to the toxicity. So you all know that nitrous oxide has a very bad effect on the hematology. So it has a major interaction with the vitamin B12 metabolism. So because of its antagonism effect on B12 metabolism, it inhibits the methionine synthesis. This leads to decrease in DNA production. Because of this DNA production decreases, it causes increasing RBC production and leading to megaloblastic anemia. So in hematology, it causes megaloblastic anemia. Whereas in neurology, same as you all know, this B12 is important for neurology. So because of this effect on B12, there will be deficiency in B12. Because when the patient is frequently exposed to the anesthesia, he has been repeatedly exposed to the nitrous oxide. This nitrous oxide causes effect in the DNA production and thereby affecting the B12 metabolism, leading to B12 deficiency. Okay, then moving on to halothane. This is also one of the older vaporizing agents. It's a very good agent. Nowadays we are not using because of the newer inhalational anesthetics. So as you all know, this molecule has two carbon and three fluoride, one hydrogen, one bromine and fluoride attachment. So that is nothing but 2 fluoro, 1 bromine, 1 trifluoroethylene. Then it has been found out by Michael Johnstone in the year 1956. Usually it is stored in the amber color bottle and its color coding in the vaporizer is red in color. It has a preservative of thymine with a minimal alveolar concentration of 0.75%. Then moving on to the blood gas partial coefficient, it is 2.5, which is an intermediate action. Then properties of this halothane is it is a non-explosive and non-flammable. So after giving this, what is the main effect? It causes unconsciousness and it does not produce any adequate analgesia and muscle relaxation. But ether is a muscle relaxer and it causes good analgesia. We have seen previously known as halothane. It is stored in amber color bottle and it is coded as red color. Next, moving on to the systemic effect. In CVS, it causes dose-dependent reduction in the arterial blood pressure. So if you are increasing the minimal alveolar concentration doubly, the blood pressure is also reduced. So as you increase the dose of halogen, then there will be a significant decrease in the blood pressure. Then it causes significant myocardial depression. It also blunts the baroreceptor reflex, thereby causing bradycardia. It also sensitizes the heart to arrhythmogenic effect of the catecholamine. Once you are giving adrenaline for any local anesthesia infiltration, this will sensitize the heart to the arrhythmogenic effect and causing arrhythmias in the ACS. Okay, so you should be careful while giving local anesthetic, that is lignocane with adrenaline. In the case if you are using halogen with the patient, you have to stop this inhalation agent. Otherwise, patient will go for arrhythmia. Then moving on to the CNS, then in central nervous system, it causes increase in cerebral blood flow and also increase in cerebral blood pressure. Okay. Then it has a decrease in cerebral metabolic rate of oxygen. Then moving on to the respiratory system. It has a potent bronchodilator effect. It relaxes the bronchial smooth muscles by inhibiting the intracellular calcium mobilization. The hypoxia drive is depressed even at a MAC of 0.1 MAC. It decreases ileal clearance of mucus from the respiratory tract. Nothing but the mucociliary function is decreased. So it causes the mucus to get lodged in the respiratory system. It promotes the postoperative hypoxia and anaphylaxis. So you should be very careful in giving this halogen to the hyperventilatory airway patients. Then moving on to the neuromuscular. At neuromuscular junction, it causes relaxation of smooth muscle. In the renal, it decreases the renal blood flow and thereby decreasing the GFR and decreasing urine output. Whereas in hepatic, it decreases the hepatic blood flow because of this hepatic artery vasospasm. In uterine, this is one of the important points you should know. It causes uterine relaxation. When it is, that's why it has been used during the manual removal of placenta. Once the placenta gets retained, after normal delivery, sometimes placenta won't come out. So in the retained placenta, they will post the case for manual removal of retained placenta. You have to use halogen. It causes uterine muscle relaxation. Whereas if you are giving for normal LSDS, those who are undergoing GA, you should not use halogen because what it will cause? It causes uterine muscle relaxation. So venous bleeding will occur. So uterine action only for manual removal of placenta, you should use halogen. Whereas for normal LSDS, you should not use halogen. Okay. Then moving on to the toxicity, it causes halogen shakes. This postoperative shivering because of the vasodilatation of skeletal muscle. Then that's why patient will produce shivering. So that is nothing but halogen shakes. Then halogen hepatitis. It also causes hepatitis because of its metabolites acting in the liver enzyme by increasing the ALT, AST and causing hepatitis. Then the next one is isoflurane. Isoflurane, it has 2-chloro, 1-trifluoro, methyl ethyl ether. It is an isomer of N-fluorine. It has been discovered in the year 1969 by Dr. Fox and then it is a clear, non-flammable and it is having pungent smell. It is liquid at room temperature. It is an highly potent inhalation anesthetic with the MAC of 1.17%. It has an intermediate solubility action as like the halogen. Its blood gas partial coefficient is 1.46. And when it is exposed, there is no determination on exposure to the sunlight. And here, It has been stored in the vaporizer is, what is the color? We told halogen is red color. This is purple color. Okay. Then moving on to the systemic effect. In CVS, it causes myocardial depression and also decrease vascular resistance and decrease of minimal, that is MAP, mean arterial pressure is also decreased. So, serious effect is depressive action. It preserves the barovascular reflex. This is the agent of drug of choice for, that is agent of choice for cardiac anesthesia because it won't alter the tachycardia. Even if some hypotension occurs, it won't cause reflex tachycardia. So the baroreceptor mechanism is preserved. Then moving on to this central nervous system effect, it has generally CNS depressant effect and decreasing cerebral metabolic rate of oxygen. It is the agent of choice for neuroanesthesia. It is used for cardiac anesthesia and also for neuroanesthesia. In respiratory system, it is less tachypnea and doesn't give bronchodilator effect. Then moving on to the neuromuscular junction, it causes smooth muscle relaxation. In renal, it reduces the renal blood flow and decreasing GFR and urine output. Renal, it causes decrease in renal blood flow and thereby decreasing GFR and decreasing urine output. Whereas in hepatic, decreases the total hepatic blood flow and hepatic oxygen supply is maintained. Here the hepatic arterial perfusion is also preserved, but LFT it doesn't affect. So in a nutshell, it is a good central nervous system and the neuromuscular and cardiac anesthesia. Whereas in respiratory system, it has a good bronchodilator. In neuromuscular, it has a smooth muscle relaxation, whereas in renal, it preserves the renal blood flow. And also in hepatic, it has the decrease in total blood flow. Okay. Then now we are going to see the sevoflurane, which is commonly used drug. Inhalational anesthetic is sevoflurane. It has been found in the year 1981. It has methyl isopropyl ether. It is a non-pungent and less airway irritant. Usually, here the vaporizer color code is yellow. As you all know, halogen is red, isoflurane is purple, and sevoflurane is yellow. It allows the direct anesthesia, direct injection agent, and it is the agent of choice for pediatric anesthesia. Then second agent of choice for cardiac anesthesia, neuroanesthesia, and also for asthmatic. Then moving on to the desflurane. It's found in the year of 1990. It is 2-fluoro, 1-trifluoro-methyl ethyl ether. It has a very pungent odor. It boils at room temperature. It is an agent of choice for daycare anesthesia because of faster injection and elimination. It is the agent of choice for hepatic failure and also for renal failure. Then the reason one is xenon. It is an ideal inhalational agent. It is at least soluble. Its blood gas partial coefficient is 0.14. It has a faster induction and faster recovery with a MAC of 70%. So can be given with 30% of oxygen. It is more cardiac stable. It is not metabolized in the body. It has less side effect. It is no teratogenicity and it is a non-inflammable. The main advantage is this. Main disadvantage is it is costly and needs some special equipment for delivery, and it also leads to bronchospasm. So it is a recent one with the, even though it has lot of advantage, but because of the cost effectiveness, we are not using it nowadays. But still at the process for decreasing the price. Moving on to cyclopropane. It is usually an inflammable and explosive agent. And it is a liquid gas of which is stored in orange cylinder. It increases the sympathetic tone and increases the blood pressure. It is the agent of choice for shock patient. It is cyclopropene shock. These are all the references. So in nutshell, so what are all the topics we have seen? So first we have seen the overall classification. It has been classified into two. One is gas and vaporizer. Under gas, what we have seen? Tell me. Yeah. Then under vaporizer, it has been classified into the halogenated and hydrocarbon. And the most important thing what we are using nowadays is isoflurane, sevoflurane, enflurane, and desflurane. And the recent one is xenon and cyclopropane, of which halothane we should know about the halothane hepatitis, and nitrous oxide we should know what it has been stored in the liquid and liquid under pressure. Once it has been used, it has been released as gas. Okay, so star weight is calculated based on the weight of the cylinder, not by opening the gas. Okay, so these are all the reference you can see in Miller also. Okay, thank you.